Okay, we should be good to go now.
It looks like we're live streaming. So, good morning, everybody. This is Delegate Wendell Beitzel, Chairman of the Western Maryland Delegation. We have, I think, a really good lineup of subject matter here this morning and people that are going to make presentations. And I want to thank those that are online already that will be providing presentations. And of course, we'll be introducing them when the time comes. But I want to thank all the senators and delegates for getting online here for the Western Maryland delegation meeting. This is our first delegation meeting of the year, and probably our only delegation meeting this year. We're dealing with some strange times here, and it's been difficult putting things together. We attempted to put together a meeting last summer, as we have in the past a couple of times, and because of the COVID and other things, it just didn't work out. So I'm excited that we're able to pull this together here this morning, and see my smiling faces out there from some of my other delegates and senators. So I want to kick off the meeting here this morning by asking everybody to stand and saying the pledge to our flag. And just look at the closest flag that you have around you, and we'll start out by the pledge. I pledge allegiance to the flag of the United States of America and to the republic which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. Also, at this point in time, our vice chair for the Western Maryland delegation is Delegate Haven Shoemaker. And I see Haven's on board there. Delegate, would you like to say a few words?
Well, just very briefly, Mr. Chairman, it's been a very interesting and taxing, I guess I'll use that word, session this year. And I thank you, Mr. Chairman, for putting together a great program for us here today. So that's all I have to say. Thank you, Mr. Chairman.
And before we start, I want to thank Miss Molly Cole, who's Shoemaker's staff person over there for setting this all up for us, and Delegate Buckles and my staff person in here in my office, Alicia, for what she's done for us to help put this together. So with that, I wanted to introduce a few folks that will be with us today, or just mention these folks, and we'll be bringing them on. So we're really delighted to have Congressman Trone joining us today. He's our congressman for the 6th Congressional District in Western Maryland, and he's been doing some really good things, I think, for our region of the state. He doesn't represent the entire Western Maryland district, and we have also with us, I think today, sitting in Nan Mann, who's with Senator Van Hollen's office, and I'll give her an opportunity if she wants to make a few comments later on. And we also have Sarah Roth, who's with Congressman Trone's office, and then I'll be introducing some of the other people that are presenting as we get there. Also mentioned that Georgia Ann Carter, the Western Maryland Council person, is also with us here today. So with that, I think we'll just get right into the meat of things here and ask for Congressman Trone to join us.
Good morning, everybody.
Good morning, Chairman. Congressman Trone. We got you.
Go ahead.
You're on.
Okay, great. Well, Mr. Chairman, thank you for having us here this morning. It's been a long week, but I want to thank all your leadership and the rest of the delegation's leadership, and give you a quick update from Washington. Obviously, the only way we win is we win together and we work together. And so much bipartisanship, that's got to be the word of the day. Vaccine rollout, I want to touch on that. I think overall, unfortunately, in Maryland, the rollout has been disappointing, unacceptable. We shouldn't be ranked 30 or lower than that, even at 1.47 in the country. And we're not getting it out fast enough and to many of our low income communities. And the issue is a lot of importance of transparency. We've got to get the shots in the arm The vaccine is being produced. As the president said, we should have a vaccine for every man, woman, and man and woman over 18 by May 31. It will be available. There is not a question about that. So we had a federal delegation letter we sent to Governor Hogan with some suggestions. I sent him a private letter because I'm not interested in putting some ideas in the news. I'm just interested in sharing my ideas with the governor, who certainly wants to be a good partner on this and wants to get it right. I had a phone call with the governor one-on-one last week. We had an excellent talk and gave him some more suggestions, and we had a good discussion. So I'm hopeful it's going to continue to get better and better, and we're going to be able to move forward as Team Maryland, which is the whole mission, is to help our folks get the shots. We've also been working with your health departments. We spoke last week with Bob Steffens, Janelle Meyer, Earl Stoner, Dr. Barbara Brookmeyer, all the health officers, Garrett, Allegheny, Washington, Frederick counties. And their mission was, we need more transparency. We need better communication. We now, and I appreciate anything you can do to talk about, have a vaccine newsletter out, which has been copied now by many, many other congressmen. And the whole idea of the vaccine newsletter is to take the ideas from Bob, Janelle, Earl, the governor's team, put it in one location. And it's all about constituent services, how we can make it easier for our customers, our constituents. So that's the number one thing, of course, vaccine. DC, one big change this year. I was fortunate to be named to the Appropriations Committee. The Appropriations Committee is the most powerful committee clearly in Washington. To have that in my second term is a big win. And it's especially important when we have already a member, Dutch Ruppersberger from the Democratic delegation, on the committee already, which means we have 2 Democrats now in Maryland on the committee. That's the same as the state of New York. That's the same as the state of Florida. So that's really going to help Maryland with appropriations. And of course, Andy Harris is here on the Republican side. So it really gives us a real bite at the apple in Maryland. Subcommittees I'm on are transportation, housing, urban development. This is a really important one with the infrastructure bill coming down. I wanted to be on this subcommittee because we can really make a difference in our roads, 270, 15, 81, 219 North. It's going to be a $1.5 trillion infrastructure bill that'll be coming next. It'll be going right through the appropriations subcommittee and then committee. So we're going to be fighting for dollars for our state and our region. Second committee, subcommittee is a commerce, justice, and science. And we'll be working there to work on Fort Detrick and medical research at USAMRIID, which has done COVID, Ebola, Zika, anthrax, everything. And the third subcommittee is military construction and VA. I'm really focused on VA this year. We love to work with your offices on ideas you have to help our 42,000 vets. So not only am I on the appropriations committee, and we're going to get that Bio4 lab, the dollars they need in Frederick to get that only Bio4 lab in America, over $1 billion lab that's completely built and ready to go, but we can't get it open. But we've got to do that together, get that open, but also on the Veterans Committee for authorizing legislation. So we've got both ends of the apple covered for our vets. So we'd love to work with you guys on this call on ideas for vets, because we really have a real chance to move the needle and they deserve it. Something new is happening in Washington. Community project funding. Write that name down. It used to be called earmarks. We're not going to use that word again. That word, Mr. Chairman, is gone. Community project funding. It's going to roll out. Republicans, Democrats are going to be on the team together. It's all about the legislators knowing what their community needs, and so we can work to get it for our community versus a bureaucrat in the Department of Education, EPA, Department of Commerce making the decision. We should be making decisions with your input. Your input, the community input, is the whole key. There'll be significant guardrails. It's going to start slow. And we're only going to be able to fund ones that the whole of the community has significant support. That means our state delegation is crucial. Our county delegations, our mayors. So this is a big deal. We're going to have a meeting next week on this. And I'd really like to make sure everybody has a representative. If you can't do it yourself, have a rep on that meeting next week, because this train is moving fast and we want to be able to explain exactly how it works, so we can work with Western Maryland and rural Maryland on this. It's a big deal. The American Rescue Plan, as you know, passed yesterday. 350 billion state, local government, 350. It is much needed. I talked to Governor Hogan about it. Very, very supportive. Maryland, Frederick County, 50 million is the estimate. Washington County, 29 million. Allegheny County, 13.6, and Garrett County, 5.6 million of the estimates. This is a lot of money, and our county leaders and our mayors, all of them are unanimous. We had over 60 of us together on a letter, bipartisan, about the need for this in our counties and in our state to support Governor Hogan. The bill also has, which I asked to put in, $4 billion in mental health and substance use disorder treatment. America's getting hammered worse than ever because of COVID on addiction and mental health. Deaths are 83,000 last year, up 111% in Allegheny County, 50% or more in Washington. So the bill also has $20 billion to speed up the vaccine. As the president said last night, we've got to outrace the South African, the Brazilian, those other mutations by getting the shots in the arms quicker. It's a race before they mutate and spread. And anything your office has, your people have questions on, call our office, Sonny, Sarah. I mean, my mission is I work for you. I work for the same folks you work for. We're one team, and all we care about is get the damn vaccine in everybody's arm. K-12 got 130 billion. Our colleges got 40 billion. I've spoken to all of our college administrators and our college directors by county. They really, really need the money. Unemployment's already coming out in checks. A $300 increase per week goes through September 6th. The direct payments, $1,400. If you're under 75,000, that is very, very generous, and that'll be coming out shortly also. Child tax credit is a huge change, went from 2,000 to 3,000 per child. It's estimated this will cut child poverty in half. We have 11% of our children are in the poverty, below the poverty line. In Congress, last thing, we're off to a quick start on mental health and addiction. We've put in 3 bills already. Our Family Support Services Act, bipartisan, bicameral. Our Mental Health and Substance Use During Emergency Act, bipartisan, bicameral. And our Effective Drug Control Strategy Act, where we work with the ONDCP, again, bipartisan, bicameral. We met with all of our stakeholders in a test we're doing in Washington County. We picked one county to start with, and we had everybody with us together. We had great support from the governor's team. Steve Shue's team was all there, and to drill down deeply into Washington County on what we need on substance use disorder. So we really had a big listening session after we did a ton of research, all at Washington, and all the stakeholders were there. The governor's team was extremely pleased. We identified a lot of things that really need to get focused on. Adolescent service was one of the biggest takeaways from that. So we're going to want to work with the state delegation on those results, and then through community supported funding to help those areas. On T&I, this broadband bill is going to be in it. We've been hammering on this for 3 years now. We've got to get the broadband in America fixed. It directly impacts, you know better than I do, Garrett, Allegheny, Washington, good parts of Frederick and Carroll. It's $100 billion. It will be in the infrastructure bill. And that is, has to happen. We've seen what happened to our kids with tele-ed. They didn't keep up. So those are some of the things we're working on. But the teleeducation, the telehealth, and the telework, I think the telework can rejuvenate rural America by folks say, I want a good cost of living. I want a chance to go fishing, go hiking, go hunting, and all the things we can do in rural America that gives us a phenomenal lifestyle and still have a job. It's a good paying job that might be in Washington or Philadelphia or wherever. So anything I can do to work is bipartisan, Team Maryland. I'm on board. I really, really am here to help you. I love problems. Send me your problems and let me have a shot at trying to help you fix them because we all work for the same folks. Thank you, Mr. Chairman, for having us here today.
Thank you, Congressman Trone. And I do want to start out by saying that your staff has been really helpful addressing any of the issues that we presented to them. Sonny and Sarah have been tremendous. You got really good people helping you out there. I want to personally thank you for the work you've done on 219. You've been a real champion working with Pennsylvania and stuff to move that ahead. And we got a little section there to complete yet. And you've been a real warrior in helping lead that effort to get that done. The other thing I'd like to thank you for is the Luke Mill issue that, we had someone purchase those machines. We have a prospective buyer there, and we had a problem with the ambassador to Turkey. They want to bring they're purchasing those machines, want to bring their people over, and they couldn't get over here. So you help with that. So we appreciate what you did there. And your work on mental health and addiction is just to be commended. So thank you for all those things. And I have some questions from some of the other members of the delegation here. I'm going to start out with Delegate Pipke. Delegate Pipke, go ahead and ask your question.
Thank you, Mr. Chairman. Congressman Trone, good morning. Your long and substantive presentation. I just had a quick question at the beginning of it. You had mentioned that you had sent a letter to the governor, maybe with some suggestions, a private letter. So my question is, the rollout, is it because the state is getting adequate vaccine doses and we're not administering them in a timely manner, or is it because the state is not getting adequate vaccine doses and we're administering them as they come in? If you could please explain to the delegation, which one is it?
Well, it's a damn good question. And there's going to be, I've spoken with Novavax, Pfizer, Moderna, J&J, and AstraZeneca. I've talked in the last 10 days with every single vaccine company, and we have the numbers on how many millions of doses are coming out each week from each company, how they're scaling. So number one is the state doesn't have enough doses that we'd like to use, but no state does. Every state is being apportioned doses on a population basis approach. So we don't have enough. Larry doesn't have enough, but no one doesn't have enough. The opportunities to make this better, and it should be about our customer who wants to get the vaccine, those that need it, that are in the 1A, 1B, 1C, and make it easy for them. Where we've missed it, is we needed one centralized location where you, your family, your neighbors registered, put in your age, put in your underlying issues, put in your occupation. Then we have that sorted in a computer file, and then we contact you. And we've got to scale up locally. These mass vac centers are hurting awful lot of areas that are making folks leave areas to go to a mass vac center over in Prince George's County, Baltimore City. Those vacs are coming off the top. So every vac that goes to those centers is before the governor can distribute it equally throughout the 24 jurisdictions. So I don't support those mass vac centers. And when I talk to my hospitals, whether it's Meritus or Garrett or Frederick or anybody in Montgomery, it's clear we've got in our hospitals and our public health officials the ability to scale up. But instead, they've gone out and built these because they look good in the press. Well, I don't give a damn about that. We ought to be getting them through Meritus. I mean, Dr. Joshi over there is doing 3,500 a week. He can go to 14,000 a week. I mean, it's unbelievable. We have the ability in our counties to scale. All the people say the same thing, but we've got to have one centralized method. We reached out to other states. West Virginia has done it the best. They got one way, one place you call. And when I talked to folks about it, their answer was, well, what if that system fell down? Well, you know what? I run a business all over the United States. It's billions of dollars, and we've got platforms, and I understand technology. And the technology that we run as just a family business is way bigger than what they're talking about here for Maryland. This is absolutely technologically able to do it. But a lot of our folks and the bureaucrats don't understand cutting edge technology. West Virginia, they got it right. Keep it easy for our voters.
Thanks for that.
Delegate Pipke, we got a couple other people want to ask some questions, and we got to cut them a little short here because we got two other presenters. So I have a quick question here from Delegate Krebs and Delegate Krim. So Delegate Krebs, do you want to go ahead?
Thank you, Congressman Catrone. Two things. Congratulations on your appointment to the Appropriations Committee. And we're your neighbor here in Carroll County, but I want to put on your radar screen a VA nursing home that George Owens has just announced that we're going to be putting on the campus at Springfield Hospital in Sykesville that will definitely help Western Maryland. It's been a priority of the governor and of our Secretary of Veterans Affairs. It's a 125-bed nursing facility, and Department of General Services has already identified it. So keep that in mind because federal funding is, I think, 85% of the cost. So put that on your radar. We only have Charlotte Hall as the only veterans home we have currently in Maryland. And this will be a real feather in our cap for our veterans. And secondly, we're having a lot of problems with veterans benefits because the archives has been shut down, and we have people that have been waiting over a year to get back about veterans benefits. And they said it's because the archives was shut down and they couldn't get some of the paperwork, and the VA couldn't even process these things. And in Carroll County, we have a veterans benefit coordinator, and we've got dozens of people still waiting in line for over a year because the federal government has been shut down and they can't get their paperwork done. So please reopen. Some of these people have died before they've gotten their benefits. So between the archives and the VA, we need to take care of our veterans and their spouses. So put that on your radar screen, please.
So quickly, big win on the nursing home. We're totally with you on that. It's so needed in Western Maryland. And on the benefits side, I'm on both issues that I said, authorizing and appropriations. You're not in my district, but I don't give a damn. I mean, Congressman Raskin is very busy with some personal tragedy that he's had in his family. But my number one mission is constituent service. If I get that right, I can get a lot more done here because I don't have to waste my time raising money and campaigning. I can work on policy because that's what I like. So
thank you. I'm sure your other counties are having the same problems with the VA. So
you should reach out to my office and we can help you and Carroll. Okay, we're delighted to help Carroll County. Reach out, talk to Sarah, talk to Sonny, and let us go to bat on specific cases. Because when we call, they're going to listen.
Thank you very much.
Thank you, and Delegate Krim.
Good morning, Congressman. First of all, I wanted to thank your office for the broadband letter you sent to support my legislation in Economic Matters Committee. So thank you very much. I did do a telework bill that passed nonpartisan here in the House, and it's now over in the Senate. We do have a cross file on that, so any support you can lend to that effort would be great. I'm president of the Women's Caucus, and we just had our Women's Veterans Day event. Many times when we talk about veterans, women veterans get out of the conversation in some way. So we have pushed them to the forefront in the Women's Caucus. So when you're doing all these veterans issues, please don't forget the women. I will follow up with Sonny on the other stuff. I know Wendell wants to move here and get to other people, but thank you for all your work.
And we completely agree on the women piece. We had a hearing on it a week ago with Debbie Wasserman Schultz, a woman who's head of the VA MilCon committee. She runs the subcommittee, and the whole hearing was about women's veterans' rights, fertility treatments, all kinds of stuff. But the women have clearly been left behind. So, and Wasserman Schultz, she is leading on this. So thank you.
Congressman Trone, we just want to thank you so much for taking time out of your busy schedule to come be with us. We could spend the whole hour easily with you. You're just so full of information and enthusiasm. So thank you for being with us here today. And we will have other opportunities in the future, I'm sure, to let you come on and keep us updated on the issues that things are going on in Washington. So again, thanks for being here with us.
Thank you. Let's continue as a team. That's the whole key. This business doesn't have enough teamwork in it in Washington, and it ticks me off. So I appreciate that. Thank you. Bye-bye.
All right, bye-bye. We're going to move on now. We're going to ask Secretary Tiffany Robinson to join us and update us on the unemployment issues. That's been a really big concern of ours, and we're still having some issues, I'm sure. And so if you, Secretary Robinson, if you would take over, welcome.
Thank you so much for having me this morning, and good morning to the entire commission. And I want to start by also saying thank you to Congressman Trone. He's been a great advocate for our customers and his constituents, as have all of your offices. So before I start, I want to put that out there. I have, I'm not sure, we sent some slides over, and I'm not going to take a lot of time on them because you have all the information, but I would like to run through some of them. I think it's a little bit easier if it's on the screen. I think I have, if it's easiest, I think Andrew Fulginiti, my legislative director, is on. Andrew, do you want to share those slides so I can walk through them with the delegation?
Sure.
And Sarah, would you help let him, Sarah will let you in, I think.
Perfect.
Sarah, excuse me, Molly, would you let him in?
I don't know if Molly has the ability to share. It's not allowing me to share my screen.
Oh. I think Molly has the slides as well, if you wanted to just share them.
Molly, can you help us out?
Yeah,
them,
I
that's fine,
can share. 1 second. Let me pull them up.
Okay, thank you.
No problem.
You guys have
There we go.
and ambitious schedule this morning, so I'll try to be brief so that we do have some time for questions. Thank you, Molly. If you want to just scroll through the first couple slides, there we go. Oops, you can go right past that one because that's just an agenda. There we go. I wanted to just start by kind of laying the overarching picture of what has happened and some things we've accomplished, because it's been a rough year, but we have accomplished much. And so I want to remind everyone that since last March, we have received over 1.7 million new unemployment insurance claims. That's historical, as is the fact that we have paid out over $10.3 billion in state and federal benefits to our customers. So every single claimant that files a claim in our system has to file a weekly claim certification to get payment every single week. We've received over 21.7 million of those certifications and paid 18.6 million of them. I will remind everyone that an issue can arise on an unemployment insurance claim under state and federal law every single week. Those weekly certifications are the customer's request for payment and redetermination of eligibility. We have to redetermine it every single week. So issues can pop up, and it's why you can imagine this program is very complex. I didn't write the laws, and you know this is a federal program that has a state overlay. So it's why we have so many customers calling again and again and every week, because different issues arise on their claims every single week. But we have implemented during this time 10 brand new federal programs. We have added at this point, over 1,150 new unemployment insurance employees. That's historical as well. I will just remind everyone that the Department of Labor pre-pandemic was right at about 1,600 employees, and our Division of Unemployment Insurance was right at about 400 employees. So the fact that in 10 months, we've added over 1,000 employees to the Division of Unemployment Insurance in the Department of Labor is pretty historical for a state agency to do. Those employees all have to be trained on Maryland and federal unemployment insurance law. Some of them are trained to do different parts of the job. That work is virtual in this COVID pandemic unique time that we're living in. So those employees are not able to shadow another unemployment insurance claimant for months on end like they normally would in a normal training process. So we have created virtual training modules, and we are literally streamlining and expediting the way we do every piece of unemployment insurance. We have a virtual agent as well that has conducted nearly 2.9 million conversations because it is nearly impossible to answer over 20,000 calls a day that we receive. So for that reason, we've created a virtual agent, a live chat. We have an IVR line. We have the Salesforce email inquiry, lots of different ways to communicate with the department because of the overwhelming volume we have experienced. And I would be remiss if I just didn't remind everyone that our layoff aversion fund, which was funded through 2 rounds, over $31 million, averted nearly 6,000 layoffs and saved over 21,000 jobs. And that program was run through our Division of Workforce Development and Adult Learning. So we're really proud of that. So we'll move through the next slides a little more swiftly. Thank you, Molly. This chart, I love this chart because it gives everyone just a really clear picture of what happened in terms of unemployment insurance claims during this pandemic. You can see the spike that hit us almost overnight. A little bit impossible to be fully prepared for a global pandemic. But we only received about 170,000 claims in 2019. And I will remind you, since the beginning of the pandemic, we've received 1.7 million. 1.4 million of those were just from March to December of last year. So that was more than an 800% increase in volume. We had weeks where we received over 100,000 new claims in a week. And to put that in perspective, back during the Great Recession, 2009 and 2010, the highest level of claim volume we ever saw during that time was 6,000 claims in 1 week. So it doesn't even compare to what we're experiencing during this pandemic. And as I mentioned, as of last week, we have received over 1.7 million new unemployment insurance claims. So Molly, we can move through the next slide. I'm not going to go through this in detail, but I do want to mention, and Congressman Trone probably had to run, but we've spoken with his office about this as well. The federal funding model for unemployment insurance made it very difficult to ramp up quickly. The UI is funded through the federal government, USDOL, on a resource justification model. That means we're funded based on workload. So our capacity, as the capacity across unemployment insurance programs in the nation, was at its lowest staffing levels in decades pre-pandemic, because our unemployment insurance rate was extremely low. We were proud of that. We were proud of our tax rate, but the pandemic hit and our volume spiked. And yet we didn't have the funding from the federal government at that point in time to have that level of staff. So we started requesting grants. The federal government started to step up, but it took time for us to hire and bring vendors on board and increase to the levels where we could, manage this volume. We also obviously expanded our call center. We are now operating 7 days a week. We've been doing that since last summer, and I already talked about the additional staff. So Molly, we can go to the next slide. I want to talk a little bit about fraud because it's a really big problem. We are working day and night with our federal partners in USDOL's Office of Inspector General, the state police, the U.S. Attorney's Office, and because it is such a problem nationwide. This is a different type of fraud than the unemployment insurance programs across the nation have seen in the past. There is always the normal type of unemployment fraud, as it is called under the federal system, which is when someone is claiming unemployment and they're still working, or they're not reporting their wages and they're taking unemployment. That's a different type of unemployment insurance fraud. The type of fraud we're seeing now is from identity theft. Bad actors have utilized, former national breaches. There's identity in the dark web that we are told they are purchasing for Bitcoin. There are international fraud rings that are really taking advantage, unfortunately, of these expanded and enhanced federal programs that are streamlined. And once they have a person's social security number, name, and date of birth, they can file a claim and it gets verified through the Social Security Administration, which is the first thing our system does for a claim. And in the beginning, this was really tough. States, thankfully not Maryland, but early on, states were reporting major losses in unemployment insurance from fraud. We didn't anticipate having to launch a brand new modernized UI system in the midst of a pandemic. But this is one of the reasons that I'm so glad we did, because our system has been able to flag over half a billion claims as fraudulent. And that happens because of the heightened security measures in place, all kinds of triggers. I'm told by our federal partners that I can't tell everyone what those triggers in our system are, because that sends a message to the fraudsters. But we are working with national practices in other states and all of our federal partners to tweak those triggers every single week, because the fraudsters get smart and find ways around those systems. I will tell you that we know we're doing something right, because of the 500,000 claims that have been flagged for fraud, over 87% of those have turned out after investigation to actually be fraudulent. So the small percentage that gets caught up that for identity review, we have an entire team of people working through those documents. We ask claimants to upload 2 forms of identification, and we review to make sure that they are a valid claimant. We actually have a vendor coming on board through a competitive RFP in this next week or 2 that will help us do that more automatically and faster. So Molly, we can move to the next slide. I'm not going to go through this, but this slide shows you all the different ways that a claimant or an employer can report fraud to our department, or request a 1099-G. You can move to the next slide, because I want to talk a little bit more about some of the scams we're seeing. So this slide just is a reminder of things that our department will not do. We won't request assistance with unemployment insurance through any Venmo or Cash App. We won't provide assistance through direct message on social media. We won't arrange for teleconferencing through Zoom or Google or Skype. You can read all of those things that we will not do. And if you go to the next slide, I'll explain why all of this is important. We have a nationwide issue. I was on a call with all of my counterparts across the country about this yesterday. There are scammers putting up fake Department of Labor pages across the country. We have seen several of them, and the federal government, USDOL, is asking us to send them. We've been working with Facebook and Twitter to get those pages removed immediately, but USDOL is now asking us to send them to them because they have a relationship with those social media platforms to ensure that those get taken down. Alabama, yesterday on a call, told us that they had over 20 fake pages put up into Facebook in a 2-day period last week. And so they have to constantly monitor and get them shut down. They look very similar to our Maryland Department of Labor page, but they'll have a period at the end or a 1, or there will be a typo. And what's happening is the fraudsters are putting a page up. It doesn't have the blue check mark as verified. So make sure, we want to make sure our customers are looking for that. And we're sending direct messaging to our customers about this as well. But they're going in and they're taking comments from those pages, sending direct messages to those customers and asking for private information, which we as a department would never do. And then they're using that information to file fraudulent claims. So it's a huge problem. We're told that USDOL is going to be making an announcement and working closer with states to combat this even further. But we are doing a lot in Maryland. And so we got a message from USDOL this morning asking Maryland to collaborate with them in some of the measures they're taking because we're flagging more claims than most states. So you can move to the next slide, Molly. And I won't go through this in detail. This is our processing slide week by week. As you probably know, USDOL releases our claims numbers every single Thursday morning. So as of yesterday morning, we have processed over 96% of all claims. We have 3.7% claims that are in a pending bucket. Those are the claimants that call us the most and who we are continuing to add staff every single week. We will not stop until we get through every single person's issue. Many of these claims are in adjudication and waiting for an interview because they are being investigated. Many times there are multiple employers in a claimant's base period, And sometimes multiple employers have disputes on the claims. Disputes can be related to the employer oftentimes tells us that the claimant voluntarily quit the job and it was not due to COVID. That's an issue that has to be investigated and or mitigated under our state laws. Sometimes there's misconduct. Sometimes there's a pension or a severance payment that has to be reconciled. Those are all issues under our state law that require an in-depth investigation and mitigation on our department's team. So it does take some time. But as you can see, thankfully, our claim volume is dropping slowly but surely. We had 13,582 new claims, and I almost said we only had 13,000. It's unfortunate that is a new low number. As you may remember, back during the Great Recession, the high weekly claim volume was 6,000. So even that number is high, but it is much lower than the 20, 30, 40, 50, even 100,000 per week that we've seen in the past. We can move to the next slide. That's just the breakdown of funding, so we can keep scrolling through in the interest of time.
Yes.
This is the breakdown of claims per your jurisdiction, so you can all look back at that. Molly, we can keep moving. See if there's anything else we wanted to hit on. I'm not going to go through the Continued Assistance Act too much, except for to remind everyone that claims were benefits were extended with the extra $300 per week back in December. And because of our new system, we were one of the very first states in the nation to program and implement all of those extension programs with no gap in or interruption in payments to our claimants. Molly, you can go to the next slide. I won't go through the American Rescue Act in too much depth because Congressman Trone did a great job of that. I will just remind everyone that this act does extend and enhance those same benefits all the way through September. So claimants can continue. It's thankfully, they did not change the rules of the programs, which they have done many times when they have launched new federal programs. This time, I think based on feedback from our national organization and our state partners, including Maryland, we begged them to keep the programs the same and in line so that we could be streamlined, just extend the same benefits to claimants instead of having to put new rules into the system. That's what they did. And so almost every program is extended through September 6th. So we can go to the next slide. And I think everyone is familiar with Governor Hogan's Relief Act. We waived charges for employers in their experience rating. If you want to go to the next slide, I want to explain this just briefly a little bit better in light of this is the narrative of what happens. If you go to the next slide, there's a chart. There we go. I want to just make sure that everyone understands so that you can answer questions for employers most easily. These are the tax tables that are set up under Maryland law for employers for unemployment insurance. What the Governor's Relief Act did, it was codify a previous executive order issued last fall that does not charge any employer for layoffs during the pandemic. The charges in an employer's experience rating during the pandemic are the ranges in that second column under each table. So we made sure that no employer is going to go up to the highest experience rating charge in the tax table that they fall into. That's important because if every employer had to be charged with every layoff during the pandemic, even if they were due to no fault of their own when the business was closed, most employers would be at that highest percentage within their tax table. That being said, it's really important to note that under Maryland law, the tax table that is assigned and the rates that are assigned to employers each year are based on the balance of the trust fund. And that means how much money has been paid out in a year. As you can imagine, our trust fund was hit extremely hard during this pandemic, more so than it was during the Great Recession. The Great Recession is the last time that Maryland Maryland employers went to be taxed in Table F. And so we knew that was coming because obviously the hit to our employers in this pandemic was much worse than the Great Recession. So tax rates for 2021 have been calculated at Table F, but the experience rating bill in the Relief Act keeps the experience rating at the low end of Table F for our employers. So they're getting charged less than they would have without that law. And I think, Molly, if you want to move through, I think the next slides are resource slides for you.
Madam Secretary.
Our inquiry forms, I'm done.
Okay.
So I just wanted to make sure that everyone knows that the remaining slides have a lot of information with links and tutorials for your customers should you need them. So I know you're tight on time, but if anyone has any questions, I'm happy to take them.
Madam Secretary and members of the delegation, we're not going to have time for questions. We have another presenter, but if we'd asked Molly if you could share this presentation with all the members, and if they have any questions, they can get back with you. I assume, would that be all right? If anyone has questions, they can direct them to you or your staff.
Absolutely. That sounds like a good plan, and we can send answers back to the entire delegation.
And could I ask if Ms. Robinson would come back just for questions and not to go over slides, because I think a lot of us have a lot of questions just in the future.
At some point in the future?
Of course.
Yeah. Okay, well, thank you so much for being, I accidentally hit a screen off there. So thank you for being with us this morning. And that was really helpful. And as we all know, you got your hands full and there's a lot of issues there we can see you're dealing with. So thanks for being with us this morning. Anyone that has questions, if they want to forward them to Molly or forward them directly to the secretary, I think you could probably get them answered. I apologize, we can't take any questions here. So we're going to move on to the next presenter. Thank you, Madam Secretary, for being here with us.
Thank you.
Our next presenter is Steve Shue. He's the Section Chief of Operation Intelligence Section on the COVID-19 Task Force with the Maryland Department of Health. And you all know former Delegate Steve Shue, and it's a pleasure having you with us here this morning, Steve. So you take it away.
Thank you, Mr. Chairman. It's a pleasure to be with you. It's been a long time since I attended a delegation meeting, so this is a real pleasure. I'm only sorry I didn't get a chance to drive over the mountains, which I always enjoy. And I'd also want to thank the other members of the delegation for having me this morning. And always nice to see Congressman Trone. He's got his heart into it. How much time do I have, Mr. Chairman? I want to calibrate my remarks for your schedule. I'm sorry, you're on mute.
If you could hold it to 10 minutes, I'd appreciate it, because
okay. I will move briskly along. Before I get into the formal presentation, I wanted to share with you some high-level statistics that we shared yesterday with the governor's cabinet. These numbers pertain to Wednesday data. Thursday data, yesterday's numbers don't come out till a little bit later this morning. But yesterday we reported 924 new cases of COVID-19. That's down 76% from the all-time high of 3,792 back in early December. So cumulative cases are now a little over 390,000. The new cases per 100,000 population was 13.5 reported yesterday. That's down 74%. The hospital census has been declining at about a rate of 10 per day now since January 15th. So moving in the right direction there. The census is now, as of yesterday, reported 788, down 60% from the all-time high of 1,952 back in mid-January. The total hospital census, including both COVID and non-COVID, is 7,019. That's down substantially from the all-time high of 7,545 back in early January, and stands at about 88% of the governor's trigger of 8,000. So plenty of cushion in the hospital system right now. Thankfully, daily deaths have declined by 72%, are currently averaging about 13 per day. But sadly, over 7,800 of our friends and neighbors have died as a result of COVID. Testing is currently running at about 31,000 tests per day. That is down 36% from the all-time high, but positivity rates are down a lot to 3.6%. That's off 62% from the all-time high. So all major metrics, Mr. Chairman, moving in the right direction. In terms of my formal presentation, I wanted to kick off by putting into perspective how far we have come since we administered our first COVID-19 vaccine on December 14th, just 13 weeks ago. Since that time, Emily, if you could go to the next slide, we've administered 1.7 million vaccines, which is an incredible number. Our 7-day average for doses administered is more than 42,000 per day. That's up 100% over the last month. And according to CDC, Maryland is now above the national average across the board for first doses, second doses, and supply used. Next slide. Over 50% of the eligible population in Maryland has now been vaccinated. The long-term care vaccination program is nearly complete, thankfully. That is obviously directed at our elderly population. On Saturday last, we reported a new one-day record of almost 51,000 vaccinations administered. We've opened 418 vaccination sites across the state, including 4 mass vaccination sites that are up and running, with 2 more opening later this month. Our statewide call center has fielded more than 620,000 calls, including nearly 162,000 last week. The very hardworking people at the call center have helped Marylanders schedule nearly 21,000 vaccination appointments, or about 1,100 per day. And I know Congressman Trone has been very vocal about having a central point of contact for our citizens, and we in fact do. The data demonstrates that under extraordinary circumstances, we've achieved a tremendous amount during the past year, and particularly since our first vaccination. The actions of the 10,000 strong Maryland Department of Health, our local health departments, and our many other state, federal, and private sector partners who've been working tirelessly has opened a massive theater scale fight in a race to vaccinate Marylanders. Our work is obviously far from done. No plan is perfect at the outset, but our ability to rapidly address the challenges and to prepare for significant increases in vaccine doses has been pretty remarkable. Last week, the governor again expressed his frustration over the fact that there are about 1 million people who are currently eligible for the vaccine who cannot schedule for a vaccine due to short supply. I share this frustration. Congressman Trone expressed his frustration. You share it. All Marylanders share this frustration. You are undoubtedly aware of the governor announcing last Thursday our plan to address the challenges surrounding vaccine equity in underserved populations across the state. Next slide, Emily. We've identified trust, transportation, technology, and vaccine information as the main barriers to Black, Hispanic, Asian, and disabled Marylanders getting vaccinated. We have a plan to address these challenges, and General Burkhead is leading its execution. Next slide. Our data team analyzed CDC data on the various vaccine doses flowing into Maryland and found significant discrepancies between what the CDC is reporting and what has been showing up on the state system. We met week before last with White House COVID-19 Data Director, Dr. Cyrus Chapar, who confirmed that 98,000 doses had been incorrectly attributed to Maryland. This still leaves about 130,000 doses that are being distributed by federal agencies that are being counted toward Maryland's allocation. This was confirmed by the federal government that they had only administered about 60,000 of those doses. So we're eager to keep working with the federal government to correct these anomalies. But despite the numerical aberrations that weigh down our rankings like a ball and chain, our national rankings for vaccines administered relative to the number delivered has improved from about 48th to 28th just over the past few weeks. I want to share these numbers with Congressman Trone because I don't think he was quite current on where we are. We also rank 17th in the percentage of people who are fully vaccinated. So we are absolutely moving in the right direction and at a very high rate of speed. Next slide. There's a great amount of interest in our allocation model. So I wanted to take a minute to walk you through how we allocate vaccines. As we've committed from day one, we start with allocating vaccines on a pro rata basis by population across all providers in each jurisdiction, just like the federal government does. When we
Hey,
get our allocation, pardon?
Steve, can I just interrupt you? I really
Certainly.
apologize. I
No
really
problem.
apologize. They rang the bells already, so I'm sure people are
Oh,
going
I totally understand.
to. So you've been here before, so
Yes, been there, done that.
and want to thank you for the report. I just want to have a little time, Steve, just to say hi. We had another Steve McHenry. You remember him?
Yeah.
But I want to thank you for being.
Oh, you went on mute, Delegate Beitzel.
I want to thank you for being here. This has been so informative, and we had such a good presentation. And so maybe we'll try to do something more here in the future before session is over to maybe make up for some of these things if the other members have questions or desire more information. So
I would be delighted.
thanks for being with us today.
Thanks for having me. Nice to see you.
Yep. And Steve, are you there?
Yes, I'm here. Can you hear me?
I'm only going to be able to let you say hi.
Yeah, great. I sent you the press release. Please read it. Thank you.
Okay, thank you, Steve. And I want to give a shout out to Noah Grubb, my intern that's out there listening. He's here. So, and also members, if you have any suggestions or questions, or you think we need to have another meeting, let us know. And Miss Molly, if you would send these slide presentations, and I'm sure Steve, it's okay to share yours.
Absolutely.
Yeah. I mean, the other Steve Shue.
Yes.
So thank you all for being here. The bells rang. We have to rush across the hall. The school bell rang. So again, thanks everybody for being here this morning.
Take care. Have a good session.